So in 2019, there was a systematic review conducted on the relationship between social media and youth mental health in relation to many of the concerns that we all had about the impact of this new technology on young people's health. And what was fascinating was that right up until about 2019, there are only 79 studies that address this issue. And imagine how prevalent this issue was for our children in 2019. Very, very few studies. And the other thing that this study did is it reviewed the quality of the science. Half of these 76, 79 studies were simply cross-sectional studies. So as we all know, correlation can't say anything about causation. So these were, very limited, not very rigorous studies. They didn't involve validated measures because this is a rapidly evolving technology. So most of the research studies that were in place to study mental health in young people didn't even have validated measures to study screen time or social media and its use. There's also just this rapidly evolving nature of the industry in relation to young people. So in 2019, the products that young people were using, so in order to be able to ask them out their interaction with products in 2019, you had to refer to a certain product. Well, today they're using different products, and that really makes research very difficult. But there was also lack of cooperation and transparency by industry to allow us to do this. And what we now know through the Facebook trial, the Facebook files and the Wall Street Journal investigative reporting is that lack of transparency and cooperation was also, misleading and really and really quite problematic. There are also a number of ethical, practical, and legal barriers to studying children as they interact with social media, and a number of different digital products. So first of all, many young people aren't even supposed to be on some of the platforms that they are actually using. So that becomes a problem. And then in order to really understand how young people interact and are affected by, because that's the real question, are they being impacted? Are they being negatively affected in some way? You have to get into the content. You have to understand what kind of content they're being exposed to. And so there's all kinds of difficulties asking a young person to share information about their social network, because what's in their social network are minors, and you don't have permission to then, study those people and their behavior. So it's very, very difficult to do this research, which is why we have such limited research on it. Now, in 2012, I started a study. It's a longitudinal study that involves 4,000 children who were recruited from all the school districts in the greater Montreal area. I think Montreal is similar size to Boston, as you can imagine, sampling schools across all the major school districts in and around Boston, and making sure that all of those schools represent the socioeconomic diversity in your city. And we recruited young people through an entire grade. And we were able, through passive consent from parents and through wonderful participation and partnership with the school directors, we were able to survey 76% of all children entering into the 7th grade in 2012 across these 31 schools. So it's a population-based study. Very few people got left behind. At the time in 2012, what was the big concern about digital screen time and digital products and young people? Does anyone even remember? Facebook. But young people didn't use Facebook back then. Teenagers didn't use it. What's that? Video games. Which one in particular? Fortnite, right? Fortnite was the big concern back then. So this study actually was initially designed to understand how video gaming was impacting on young people's mental health, and to understand the evolution of potential gaming addiction, conduct problems, aggressive behaviors in relation to exposure to that kind of content. But we also included measures of social media use, as well as other forms of screen time, like amount of time interacting on a computer that doesn't involve these other forms of digital media, and television watching. Now, I mentioned this problem of causation. We know that just simply looking at a correlation doesn't tell us anything about whether one thing causes another, because there could be all kinds of other third variables that will explain the relationship between two variables. The other thing is that you don't know the directionality of the relationship. So it could be in a relationship between social media and depressive symptoms in young people, that it's depression that's causing higher rates of social media. But more and more now, we are beginning to start to use big data, and this study was able to provide opportunities to do some big computational analyses, where you're basically looking at time-varying relationships between two sets of symptoms or multiple sets of symptoms, to basically understand if this is an individual over 5 years, for example. If in a given year their social media increased, sorry, this is their social media in blue. So if in a given year their social media increased over their own mean average amount of social media use over their entire course of adolescence, if in a given year it increases, do you see a concurrent increase in their depression? And then if it decreases, will you see a concurrent decrease in their depression? And this kind of multi-level modeling allows you to separate common vulnerability towards two sets of problems and start to measure some potential causal relationships between two sets of variables. And what you can even do is begin to start to measure the lasting effects of a particular event. And as I said, as Jen said in the introduction, I study disruptors of brain development. And so another way we do this is by looking at an uptick in social media, for example, and a concurrent uptick in depressive symptoms, and then how long it takes for the individual to recover if their social media decreases a subsequent year. So are there lasting, potentially neurotoxic effects of a certain type of disruptor? So it's using this kind of strategy that we're beginning to study the effects of social media and other disruptors on adolescent mental health, cognitive development, and even brain development. So this is a study where we looked at the relationship between social media and increases in depressive symptoms. And what we found year after year over a 5-year period is if your social media increased over your general level of use, you were much more likely to experience an aggravation or an increase in the severity of your depressive symptoms. And that was shown to be very robust and reliable across multiple years of evaluation. What we also showed in this study was that if you started out with higher levels of depression, you were more likely to withdraw socially and engage in social media. And then you were more likely to experience depressive symptoms from the social media time that the time you spent on social media. And we were even able to identify mediators of this effect. So social media influenced depressive symptoms by reducing someone's self-esteem. There was evidence of this idea of a reinforcing spiral, so that the more you used as a way to, I won't even assume what the motivation was, but the greater the depressive symptoms, the more likely you were to use social media, the more likely you were to use social media, the more it would aggravate your self-esteem and your depressive symptoms, and thus the reinforcing spiral. This study, it was published in 2019 and received more media attention than any other medical study published in the Journal of American Medical Association, collection of scientific journals or scientific articles. It really struck a chord. I've since been on some panels and interacting with the Wall Street Journal, who broke this story, because there's a lot more to this story. There's a lot more research out there. It's not just about depression, and it's not specific to young people and not specific to girls. What our research is showing is that The impact of social media is most definitely having also exacerbating eating disorder symptoms. The way it's doing it is through reducing self-esteem. It's not impacting young people's mood, self-esteem, and eating disorder symptoms, but through this displacement hypothesis, meaning it's not just affecting young people's mood because they've stopped physically interacting with their world. The way it is impacting on their mental health is through the content and how it's impacting on how they feel about themselves. What this study is showing, this is about to come out in press, is that you can predict eating disorder symptoms years down the road in relation to someone's social media use. So that's this lagged effect that I talked about. But the other part of the story is the role of social media in promoting addictive behaviors, substance use in young people. And in this study, which was published in Preventive Medicine, what we showed was that the more time you spent on social media, the greater your risk of being a heavy alcohol user. And the way in which that relationship was explained was through the promotion of social norms. So young people are sharing content about substance use through their social network. And by sharing that content, which we know is illegal, but it is happening, by sharing that content, they're influencing attitudes about drinking, making it seem like it's more normal than it is. And that is having a direct effect on their drinking behavior. This is also the case for cannabis. And this is having one of these longitudinal effects in the sense that even if you were to stop using social media, if the effect happened last year, you're going to see an impact on your drinking in subsequent years because it has this kind of stimulating effect. It starts you off drinking. So what was fascinating about this series of studies is that social media really came out as having a stronger impact than other forms of digital media, like television watching, although television had similar effects to social media, but nowhere near as robust. And it didn't have that same effect on eating disorder symptoms. To our surprise, video gaming didn't have the same kind of effect as social media. And the way that we explained this was there were some effects on aggression, and we're preparing a manuscript on that analysis. But what we found was that it really didn't have an effect on self-esteem and therefore mental health symptoms. So it was a nice control for social media as well. So the way in which we explain these differential effects was that, what is it that's so problematic about social media? Well, social media has this unique feature in that has a number of unique features. One, it's content that is shared by your peers. So it's realistic, it's real life content, but it's selective content. It's content that is only representing part of the story or is actually promoting unrealistic norms, attitudes, and behaviors. It also has this algorithmic nature to it. So we know there's the research that has been done on people who are willing to share their social media and that the sites and the content that they view and share and like, is that if you're in a depressed mood, you're more likely to look at blue content or content that has a depressive tone to it, and you're more likely then to be presented with content that have that same tone. So it's a combination of all of these very unique features that make social media particularly toxic for a young person. Our research suggests that all young people are susceptible. Some are more susceptible, but just because some are more susceptible doesn't mean that it's safe for everyone. And the people who are more susceptible tend to be the people who are more susceptible to other forms of risky behaviors, for example, substance use and mental health conditions. And what we know about people who, or young people who tend to experience more harm from social media is that they have traits that can be measured way before the problems evolve and come manifest. Traits such as impulsivity, thrill-seeking, pessimism or hopelessness, anxiety sensitivity, and even perfectionism are all traits that we now understand as traits that have really wonderful and unique aspects to, and they serve a very, very important role in society. It is the nature, it's the basis of human individual differences. And what makes society diverse as well as able to accommodate a number of different functions in a society. But if these traits are mismanaged, they can also lead to mental health concerns. And so many of you have questions about, well, how do we manage this? And the previous talk offered a number of solutions at the school, which I highly condone, solutions for parents, which is do whatever you can to limit the amount of time that your young person is spending on social media. Have conversations with them about the nature of the content that they're viewing and making sure that they understand the distorted, biased nature of the content. Make sure that they understand the nature of reinforcing spirals as well. But the other thing that you can do is make sure that you're attending to your child and your students' mental health. And what we now know from 30 years of research on mental health and mental disorders is that they don't just come out of nowhere. They have a developmental course to them. They can be predicted and they can be prevented, and their harm can be reduced if you intervene early. And so the work that I've been involved in has essentially taken much of what you would do with an adult who's suffering from a mental illness like depression, like an anxiety disorder, like ADHD, or a substance use disorder. And you package this work, you package these interventions as skill building workshops for young people earlier in the course of the development of any kind of problem. And you offer this as a preventative skill building workshop where young people are provided information about personality and individual differences. They're guided in goal setting, in peer discussions. This is translated very quickly. There's a couple of typos there. But the most important thing is that they're provided with cognitive behavioral skills to help them manage very specific traits that we know in interaction with very toxic, stressful, challenging environments can lead to difficulties. And I've been involved in a number of randomized trials that are conducted in communities and schools all around the world. And what we know about this type of approach, these are studies that go all the way from phase 1 right up to phase 5 in terms of demonstrating proof of concept, efficacy, effectiveness, and even impact with special populations and so on. Generally, you can delay or prevent the misuse of alcohol by 30 to 50% if you equip young people with these cognitive behavioral strategies to help them manage the traits that put them at risk of harm from social media or misusing substances and other types of challenges that you observe in adolescence. It's concurrently associated with a 30% reduction in cannabis use and an 80% reduction in illicit drug use. But what's really fascinating about this approach is by taking a mental health approach to many of the challenges that young people can face, social media, substance use, other risk-taking behaviors. The mental health approach to this is that you have the added benefit of promoting mental health generally and preventing the likelihood that a young person will transition to a major psychiatric problem like depression with suicidal ideation, anxiety with panic attacks, or conduct problems. I'm quickly going to go through this study, which essentially compares the impact of this more mental health approach to prevention relative to a classroom-based social norms approach, like a universal approach, a drug and alcohol education approach. What's fascinating is when you compare these two approaches, both are effective in helping young people delay the onset of their drinking, but only the mental health approach is effective in helping young people at risk of alcohol misuse, the more severe forms of the problem. Only the mental health approach is effective in preventing alcohol problems and alcohol-related harms. And what this study, this was a trial in Australia, what they also showed is even though both types of problems can help delay the onset of drinking, only the mental health approach has the added benefit of concurrently reducing anxiety symptoms, depressive symptoms, chronic problems, and even help young people better manage their ADHD. The last few slides here, I might be going over time, is that we also know that these traits interact with victimization experiences. So it doesn't necessarily make people more at risk. Well, that's not true. These traits do put people at greater risk of victimization, but it also puts them at greater risk of experiencing mental health consequences of bullying and victimization. And this study showed that by using the same type of preventative approach, you can reduce the likelihood that someone will experience depression, anxiety problems as a result of a severe bullying event in a school. What do young people think about this approach? Well, what's fascinating is that when it's presented as a workshop where you learn how to explore your personality and your long-term goals and learn strategies to channel your personality towards your long-term goals, 85% of high school students sign up for it, especially if it's done in person. And what do they think about it? They love the idea of sharing. They really appreciate the idea of hearing that there are other people who similarly struggle with impulsivity or have a sensitivity to anxiety and their experiences with it. They also appear to, in a very brief 2-session workshop, take home cognitive behavioral messages. They learn about their thinking. They learn to catch themselves making thinking errors and having distorted thinking. And that could be really helpful as a way to manage the impact of social media, right, on your thoughts. They also learn to set goals, and they learn about how their behavior is impacted by their thoughts. And what we've shown is that if you leave this intervention with this type of learning, you're protected over a 12-month period from taking up alcohol and developing depressive symptoms. So it's a really nice validation of the approach. There are now studies that have followed young people 5 and 7 years after a 2-session intervention like this, and have shown that youth are protected for up to 7 years with respect to their substance misuse. Early and personally relevant interventions, we now know, can equip youth with cognitive behavioral skills to help them transition through a very important developmental period, a period that's characterized by physical, neurocognitive, and social development. It's also a period when young people are hypersensitive to peer influence, and therefore making social media particularly toxic for a young person. It's a period when young people are exposed to substances and other risky contexts, often unsupervised. And it's a period in which we know that most mental disorders have their first onset. The idea is to work with schools and community organizations to equip young people so that they can more smoothly and more effectively navigate this high-risk period. And that's exactly what we've been doing. This program has been summarized and written about in joint WHO UNESCO reports. It's also referenced in the Surgeon General's report on addiction. It can also be a solution for many schools and families hoping to help manage the mental health outcomes of this new product that our young people are trying to navigate and manage their behavior around, and that is social media. With that, I'll just acknowledge all the funders and thank my team for all their assistance in the research I told you about today. Thank you.